And good morning, everyone. Welcome to Bay Area Focus. I'm your host, Michelle Griego. Please pitch us future show ideas to facebook.com/Bay Area Focus. Today, we'll talk about Motown the Musical, services for domestic violence survivors, and polo events by the Bay. But first, we'll discuss the Children's Health Council's distinctive approach to care. Dr. Joan Baran and Dr. Ramsey Khasho from CHC join me now. Thanks for coming on the show.
Thanks for having us.
All right, so the CHC, it has a unique history. It's been around for over 60 years, and it was founded by Palo Alto's first pediatrician.
Yes, Esther B. Clark.
That's amazing.
Yes, and she was a pediatrician that had just a vision about how can we provide services to kids where everything's under one roof, so families don't have to go to 2 or 3 different locations in order to get the best care for their kids.
Sure, and what kind of services does CHC provide?
We have, it's very unique to the Bay Area. We have 2 schools on our site in Palo Alto, and we also provide clinical services and educational services. And we have a number of professionals, psychologists, speech and language pathologists, occupational therapists, and we provide integrated services. So we integrate both our clinical services and our educational services.
Let's talk about those 2 schools. One of them is Esther B. Clark School, named for the founder, obviously, of CHC.
Right, it's a non-public school, and so we have about 65 to 70 kids from all over the Bay Area, and they attend the school, and there they get excellent academics as well as integrated clinical services.
And being a non-public school, that means that they can be anywhere and come to the school, or they can live anywhere?
Right, they come on what's called an individualized education plan, and so we partner with the public school district to provide care.
And the CHC, it has 4 areas of specialty.
That's correct. So we provide services in our areas of expertise, which includes attention deficit hyperactivity disorder, oftentimes called ADHD, Asperger's or autism spectrum disorders, anxiety and depression, and learning differences.
So explain, you specialize in that, and so a lot of these kids, they go to the school and they're dealing with those issues. And so tell me about the curriculum and what they're exposed to help them through that.
Well, in one of our schools called Sandhill School, it's a private independent school for kids kindergarten through 6th grade. We do have a plan to expand till 8th grade. And they provide services to students who have language-based learning disabilities, such as dyslexia. And they take a very integrated approach. So they provide physical education, and research-based curriculum, and have a number of specialists like speech and language pathologists and occupational therapists that provide support to the student. These are students who, in a typical learning environment, really struggle, and Sandhill provides them the right resources and supports so that they can be successful.
And things like ADHD and depression and autism, it doesn't just affect the student, it also affects the family, and you have services for parents as well?
Right. We have a very big parent education program, which is free. So we have more than 25 classes that we offered last year where families can come, and we cover a range from typically developing issues about how do you manage your challenging teenager to what is the diagnosis of autism, or how can I talk with my kid about their attention deficit issues. So we offer parent education, and then through our clinical services, we offer individual therapy, we offer evaluations, and we also offer family therapy for the family who may be having struggles with a child. Does it help the students to be around other students who are maybe going through the same challenges?
It really does. It's that sense of sameness, and there are other young people like myself who are struggling with this issue or having difficulties with these issues, and they learn as a group and as a team with the support of the staff at Children's Health Council to really look at their strengths and capitalize on their strengths so that they can be successful.
You've been going for 60 years now.
Yeah.
How is that possible? What's your secret to success?
Yeah, I think the secret to success is just expert clinical services, being very family and child focused. We have a wonderful support team of donors. We have a robust fundraising activities at our agency, and we just get a lot of support from the community, financially and otherwise.
Financially, you do get funding through these fundraisers, but also families contribute as well?
Families do. So some of them pay out of pocket for services and just go to support CHC.
All right, your newest initiative, tell me about that.
Oh, it's really exciting. So we've partnered with other nonprofits in East Palo Alto and Eastern Menlo Park. And it's called the Collaboration for Empowering Youth and Families. So we're going to be working with other nonprofits and the school district to be providing services, including parent education, teacher education, and our wonderful clinical services.
Well, great. Keep up the great work, and thanks
you
for coming on our show and telling us all about it. And for more information on clinical services and parent education with CHC, please log on to chconline.org. Again, that's chconline.org. Coming up, we'll meet the talented actors playing Marvin Gaye and Smokey Robinson in the Motown the Musical. We'll be right back.